Protect your cognitive vitality by learning how to avoid risks. Depression has become one of the most common mental health conditions. Rates have increased by about 60% in the past decade, especially among teens, young adults, and women, with more than 1 in 8 Americans over age 12 currently experiencing symptoms of depression. Depression, also known as major depressive disorder, is characterized by a lasting low mood and a loss of interest in things you once enjoyed. It affects both the brain and body. People may feel tired, have trouble sleeping, experience pain, or find it hard to concentrate and remember things. It can also change appetite and digestion. When depression goes untreated for a long time, it can harm the brain. Chronic stress increases cortisol and inflammation, which can damage brain cells. It also makes the brain less resilient to other stressors like pollution or metabolic problems. The parts of the brain that regulate mood, such as the limbic system, also manage important chemical messengers called neurotransmitters like serotonin, dopamine, and norepinephrine. These brain chemicals also help control attention, learning, and memory. When brain cells in these areas are damaged, the balance of these messengers can be disrupted. Most antidepressant medications work by increasing levels of these neurotransmitters. SSRIs, or selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, called SNRIs, and tricyclic antidepressants are some of the most common types. Depression is a serious condition, and among other things, may increase risk for dementia. Treating depression early and effectively may help protect brain health in the long term. But about 40% of people with symptoms, especially men, do not seek treatment. Some people avoid medication because they worry about side effects, including effects on the brain. Research on antidepressants and brain health has shown mixed results. Some studies suggest these medications may protect brain cells and lower dementia risk. Others find no clear benefit or even possible harm. By taking a closer look at these studies, we can better understand who is most likely to benefit. Studies in animal models show that some antidepressants, such as SSRIs, can promote brain growth factors that make brain cells more resilient. And in people with a history of depression, long-term antidepressant use has been linked to a lower risk of dementia. Still, antidepressants alone may not be enough for everyone. Depression is not a single disorder. Its biological causes may differ from person to person, such that one type of treatment may work for some but not for others. A key challenge for generating effective treatments is that we don't yet understand the underlying causes of depression in most cases. Some people have what is called treatment-resistant depression. Their symptoms do not respond well to current medications. For this sizable population, it will be important for researchers to figure out whether antidepressants protect the brain because they relieve depression, or if they can have protective effects even when symptoms continue. Depression that begins later in life can sometimes signal another health problem, such as early Alzheimer's disease. In these cases, loss of brain cells in mood-related regions may cause depressive symptoms. So for older adults, depressive symptoms should be taken as a sign to get further cognitive and neurological testing. Some studies suggest for people with early dementia, starting antidepressants may worsen cognition. Instead, they may benefit more from medications that target the underlying brain changes. There are many types of antidepressants, and people vary in how they respond or tolerate them. There is no clear evidence yet that one type is best for brain health. What matters most is finding the treatment that works for you. Depression is serious, but it can be treatable. If you notice persistent sadness, loss of interest, or fatigue, reach out for help. Do not wait. Effective treatments and support are available. To learn more about protecting your brain health at any age, visit cognitivevitality.org.